Are allergies making your life miserable? Are you constantly battling sneezing, congestion, itchy eyes, runny nose? We get it. Severe allergic rhinitis or allergies can be debilitating. And if over-the-counter medications and other remedies aren't providing enough relief, you might be wondering about immunotherapy or allergy shots, but is it really worth it? Today on Allergy, actually, we are exploring the pros and cons of immunotherapy for environmental allergies, helping you decide if this long-term treatment is the right choice for you with our guest expert, Dr. Christopher Brooks. We are excited to welcome our colleague and our dear friend who is an assistant clinical professor of allergy immunology in the Department of Otolaryngology at the Ohio State Wexner Medical Center. Thanks for joining us, Chris.
Yeah, thanks for having me on. This is so exciting to be here to talk about with you guys.
Maybe we can jump in with a quick refresher for maybe those who are new to the podcast. What is immunotherapy, and briefly, how does it work?
Yeah, so immunotherapy is this great tool we have in allergy that help treat allergies when medications alone aren't enough or someone wants to avoid use of medications or their side effects. So it's essentially all the different immunotherapy methods are ways that we present your body with an allergen, and over time you become less allergic to that allergen. For a while, really all we had was just conventional allergy shots, but now there's some newer methods of immunotherapy that we'll talk about in addition to normal shots, under the tongue drops, and even like intralymphatic immunotherapy or ILIT. So there's great new options for people. All of them require at least multiple injections, but classic allergy shots kind of require years of exposure to that allergen to kind of develop that tolerance to the allergen. But all these different methods, when they're used, are really effective at helping decrease allergy symptoms for patients.
Chris, what was your light bulb moment with ILIT where you thought, this is something I want to be an expert in and something I want to bring to my patients?
Yeah, that's a great question. So I actually first started exploring it back when I was actually my fellowship training at Ohio State. And even earlier in the training, I saw so many patients I thought would benefit from immunotherapy, but they didn't have the time to come in for weekly injections. And there are so many patients that we wanted to see improvement of symptoms. They were taking multiple medications, but they just didn't have the time to come in. So that's when I started to explore some of these kind of newer options that are available to patients that can still give them a relief, but don't have that huge time commitment. So I actually did, for one of the fellowship kind of lectures we have to give a fellows as we kind of learn how to give lectures, I did that on ILIT my second year of fellowship. And then I think kind of taking a deep dive into the literature all the way back to the decades or research from decades ago, early on, everything up to more recent studies, this seems like a great option. And that kind of ball started rolling from there.
And I can attest that it was a very well done presentation.
Thank you.
I think convinced us at the time as a department really to invest the time, the energy, and the money in getting trained and bringing it to Ohio State, which is exciting.
And you guys were the first. You're the first academic center.
Exactly. Yeah, we're really excited about that.
Yeah, that's a big deal. When you talk about this with patients, are there different things that you think, or I guess when you are thinking about offering immunotherapy, do you offer all of them? Like say, these are all the options and this one I think would be particularly good for you, or how do you approach that?
Yeah, that's a really good question. So after I see a patient and we start talking about different management options, normally I say, in addition to medications, allergen avoidance, there's also immunotherapy that's available. And I tell them that there's several different options and not any single option is best for everyone. So every option is kind of better for different people based on the number of allergens that they're allergic to, their kind of time constraints. Some are better or not covered by insurance. So, from a financial side too. So there's, a lot of different, reasons why one will be better for another. So normally I kind of go through saying, hey, there's, allergy shots. It's probably one you've heard of, but there's also other options available like sublingual drops and like intralymphatic immunotherapy, and offer those to people because sometimes people have been told about allergy shots and they never really even think about other options available. So we want to make sure that they know those options are available to them.
What's the youngest age that you're seeing there for ILIT?
That's a good question. So Right now, we're seeing down to 14 years old. There's not honestly a good medical scientific reason that we had that age cutoff. So as we were starting ILIT, we decided it might be just as we were, starting to get used to it, starting with mainly adult population. But I think over time, we probably will move down in age because there's good research showing that it's effective in kids. And we do other types of immunotherapy, like traditional allergy shots and like sublingual drops in kids. There's no reason to think that it would either be less effective in kids and would be unsafe in kids. And actually doing conventional allergy shots has been shown to be protective in development of new allergies. So, it's possible that doing ILIT for younger ages actually could be a good thing in helping maybe prevent development of new allergies.
Yeah, as that immune system is more flexible in childhood, like the rest of our bodies.
Exactly. Yeah.
I think the youngest kiddo, because when I first started doing it, I offered it to both, but it was a while before it was sort of catching on in my area. And so I think the youngest kiddo I started with was 6, and now we've gone down to 5. And so it has overall been tolerated very well. The kids, some of them are fearful, some of them are just ready to get it over with. But by the 3rd shot, nobody is crying or, as upset as they were like mentally preparing for the first shot, because it's such an easy process. And by the end, they have learned that. And so that has been a nice thing too, because to be honest, with normal subcutaneous immunotherapy, the shots that start out weekly in your arm, that doesn't often happen. Like kids still are mad about it, after a while. And so I find that ILIT is a smoother method to do that if we're still talking about a needle type of option.
Yeah, I completely agree. Yeah.
Chris, would you want to share a quick patient story? Somebody who maybe benefited from ILIT or?
Yeah. So, I've had, a number of patients that have had amazing success stories with ILIT. I've had one particular patient who I remember she came in trying every medication to the point she was even missing days from work. I think most of this patient's allergies are mostly pollen were the worst ones. And she got ILIT. And, I think it was even, so on average, at least from studies, a lot of patients don't see improvement until after the last dose. But I've actually been seeing a lot of patients seeing improvement earlier than that. And I think even before the 3rd dose, she was like, I'm already starting to see improvement. I'm so excited. And by the time I saw her 3 months after the last dose, she was like, this is amazing. Who else can I tell about this? And actually, she went on to do an interview with our local media station about it. And she was talking about it, telling everyone about it. So, I've had some really good success stories with it. Just like any immunotherapy, it's not going to be, 100%. And that's how it is with any immunotherapy. But, I think that it's been shown to be very, helpful for people, even people that have done allergy shots before and they weren't as effective. Or I also had another patient who she had a history of having severe allergic reactions to allergy shots to the point that her local allergist was like, we can't do these anymore. She lived far enough away from us that we couldn't even really consider doing conventional allergy shots because it was too long of a drive, but it was reasonable to come 3 times to do ILIT. So also they did not have an allergic reaction to ILIT. So they're being able to get the treatment. So we've had some really good success.
Wow. Final thoughts?
Yeah. So, I've been, really excited to offer this treatment. I think for patients, it's fantastic to have options because not every option is going to be best for everyone. So I think the more options we have for patients, the better. And this adds a, great option for a lot of patients where, they really want to take care of their allergies quickly. They want to come in for those 3 injections and kind of be done with it and move on with their life and do all those other important things that, we have to do and enjoy life.
It really sounds like immunotherapy can be this personalized, precision-based, life-changing treatment to really treat severe hay fever and asthma. But it's essential to weigh those pros and cons carefully, and making an informed decision is key. And really, it sounds like what you're doing is empowering patients with the knowledge to make that best decision for themselves.
Yeah.
Thank you so much for joining us today, Dr. Brooks at Ohio State University.
It was so great to be on with you guys.
And if folks are ready to discuss immunotherapy options with their expert, you can find board certified allergists that are part of the Auni Learning Network, which Dr. Brooks, Dr. Shepard, Dr. Patterson, and myself are all a part of. And they can help you decide if immunotherapy is right for you, guide you through that whole process. And until our next episode, take care and make sure to subscribe and hit the notification so you don't miss our next series on Allergy Actually.